Hello, I am Dr. Siddhart Yadav, Orthopaedic and Joint Replacement Surgeon at Apollo Hospital, Navi Mumbai. Today's topic is knee arthritis, which is main or common cause of knee pain in all the age groups. Knee arthritis is very common nowadays. The main reason is lifestyle. The main risk factor for knee arthritis development is overweight, lack of exercise and nutrition deficiencies. तो आजकल जो कॉमन नी पेन हो रहा है सबको विच स्टार्ट एट एज ऑफ 30 to 40 ईयर्स, उसकी वजह जो है वो लाइफस्टाइल की वजह से है. बिकॉज ऑफ लाइफस्टाइल वी हैव पुट ऑन वेट, वी आर नॉट डूइंग एक्सरसाइजेस, तो आवर मसल्स आर वीक एंड दैट्स व्हाई वी आर गेटिंग एबनॉर्मल लोडिंग और ऑन नी जॉइंट विच इज कॉजिंग मोर वेयर एंड टेयर. दिस वेयर एंड टेयर ऑफ नी is called osteoarthritis or age-related wear and tear. Now it is start at the age of 40 and gradually it progresses up to 60 years. So it has various stages, stage 1, 2, 3, 4, and every stage has different treatment. For example, if we diagnose someone is stage 1 by doing X-ray, so we can do certain prevention, certain treatment, so it will not progress into stage 2. Or same way, if we diagnose stage 2, so we'll start treatment. It will not progress into stage 3 and 4, because when it goes in stage 3 and 4, then operation is required. So early diagnosis, early treatment, we can prevent arthritis progression and we can prevent operations. Now what are the treatment when we diagnose early osteoarthritis? First is non-medical treatment. In non-medical treatment, we start dieting program where you reduce weight. We start exercise program where you increase your knee joint muscles, so your knee can withhold your weight properly. And third is medical treatment. Medical treatment, some are protein. We start oral protein supplement, collagen peptide, and in some cases we give autologous protein solution, APS, in which we remove your own blood and we separate growth factor. These growth factor, they help in healing cartilage. So this is your own blood is given to your knee joint for regeneration or self-healing. After that, if someone comes later on, then also we start this program. Apart from this, we can do partial knee replacement or bone correction osteotomy called high tibial osteotomy. And if everything fails and patient is 60 years old or more, then we go for knee replacement. In knee replacement, we have latest technology where you get minimal pain, very fast recovery, and discharge is in next 2 to 3 days. We use latest technology like computer navigation, robotic navigation for more precision. So if we follow all this, the treatment can be very accurate and it is very helpful. Arthritis can be cured at any stage, with operation, without operation, but you have to approach doctor at the right time. Thank you.